NCLEX-RN questions and answers made incredibly easy. ISBN 9781 4963 2549-5 or 7th edition. Lisco, Dr. Susan or Lisco Susan. Print page break 249, Chapter 10. A client is asked to empty her bowel before treatment with intracavitary radiation for cancer of the cervix. Which statement by the nurse best explains why this is important? 1. Feces in the bowel increase the risk for ileus. 2. An empty bowel allows the applicator to be positioned with little or no discomfort. 3. Bowel movements increase the risk of inadvertent contamination of the vagina and urethra. 4. Pressure changes in the pelvis associated with bowel movements can alter the position of the applicator and the radiation source. 1. View answer. 1. 4. Feces in the bowel increase the likelihood of a bowel movement, which can change the position of the applicator and radiation source. Pressure changes that occur during a bowel movement may cause a position change of the radioactive implant, resulting in the delivery of radiation and injury to healthy tissue, and less to the malignant lesion. Feces in the bowel do not increase the risk of ileus or inadvertent contamination of the vagina and urethra from a bowel movement. Applicators are usually inserted under anesthesia in the operating room. CN, physiological integrity. CNS, reduction of risk potential. CL, analyze. 2. A healthcare provider tells a client diagnosed with a sexually transmitted infection to return 1 week after antibiotic treatment to have a repeat culture done to verify the cure. This order would be appropriate for a client who has 1. Genital warts. 2. Genital herpes. 3. Gonorrhea. 4. Syphilis. Send 999 or 142.204.35 194 or September 25, 2025 3:44:23 UTC. NCLEX-RN questions and answers made incredibly easy. ISBN 978-1 4963-2549-5 or 7th edition. Lisco, Dr. Susan or Lisco Susan. 1. View answer. 2. 3. Gonococcal infections can be completely eliminated by drug therapy. This is documented by a negative culture 4 to 7 days after therapy is complete. Genital warts are not curable and are identified by appearance, not culture. Genital herpes is not curable and is identified by the appearance of the lesions or by cytologic studies. The diagnosis of syphilis is by dark-field microscopy or serological tests. CN, physiological integrity. CNS, physiological adaptation. CL, apply. 3. What is the best question a nurse can ask a client when determining the type of incontinence the client has developed? 1. Do you drink alcohol daily? 2. Do you have a busy job? 3. Are you incontinent when you cough or laugh? 4. How old are you? 1. View answer. 3. Stress incontinence is the most common type of incontinence. The primary symptom is the loss of small amounts of urine when the client coughs, sneezes, jogs, or lifts. The person with stress incontinence cannot tighten their urethra enough to prevent leakage. The nurse should ask this question to determine if the incontinence occurs at these times. Alcohol, busy jobs, and age are not significant risk factors. Stress incontinence can also occur after childbirth. CN, physiological integrity. CNS, physiological adaptation. CL, analyze. Print page break 250. 4. A client has been diagnosed with a chlamydial infection, which statement indicates that this client understands the potential complications of this infection. 1. I'm glad that I'm not pregnant. This disease can cause birth defects. 2. I hope this medicine works before this disease destroys my kidneys. 3. I should have used birth control pills to decrease my risk of this disease. 4. This infection can lead to infertility, and I need to have it treated. 1. View answer. 4. 4. Chlamydia is a common cause of pelvic inflammatory disease and infertility. It does not cause birth defects or affect the kidneys. It can cause conjunctivitis and respiratory infection in neonates exposed to infected cervicovaginal secretions during delivery. Using birth control pills does not decrease the risk of infection. CN, physiological integrity. CNS, reduction of risk potential. CL, apply. SEN 999 or 142.200 and 4.35.194 or September 25, 2025, 3:44:23 UTC. NCLEX-RN questions and answers made incredibly easy. ISBN 9781 4963 2549-5 or 7th edition. Lisco Dr. Susan or Lisco Susan. 5. A client with genital herpes asks the nurse to recommend comfort measures for the virus. What is the nurse's best response? 1. Wear loose cotton underwear. 2. Apply a water-based lubricant to the lesions. 3. Rub rather than scratch in response to an itch. 4. Pour hydrogen peroxide and water over the lesions. 1. View answer. 5. 1. Wearing loose cotton underwear promotes drying and decreases irritation of the lesions. Other types of underwear, such as silk and synthetic, tends to trap moisture. The use of lubricants is contraindicated because they can prolong healing time and increase the risk of secondary infection. Lesions should not be rubbed or scratched because of the risk of tissue damage and additional infection. Cool, wet compresses can be used to soothe the itch. The use of hydrogen peroxide and water on lesions is not recommended. CN, physiological integrity. CNS, basic care and comfort. CL, apply. 6. It is most important for the nurse to provide teaching of breast self-examinations to clients who have 1. Cervical dysplasia. 2. A dermoid cyst. 3. Endometrial polyps. 4. Ovarian cancer. 1. View answer. SEN 999 or 142.200 and 4.35.194 or September 25, 2025, 3:44:23 UTC. NCLEX-RN questions and answers made incredibly easy. ISBN 978-1 4963-2549-. 5 or 7th edition. Lisco Susan. Client's breast cancer. Breast self-examination are crucial to early detection and treatment. There is no known relationship between breast cancer and cervical dysplasia, endometrial polyps, or dermoid cysts. CN, health promotion and maintenance. CNS, none. CL, apply. 7. A 38-year-old client attends a follow-up visit after having a vaginal hysterectomy. She has an elevated temperature and decreased hematocrit. The nurse understands that these symptoms could indicate 1. Hematoma. 2. Hypovolemia. 3. Infection. 4. Thromboembolism. 1. View answer. 7. 1. An elevated temperature and decreased hematocrit are symptoms of hematoma. Symptoms of hypovolemia include increased hematocrit and hemoglobin values. Elevated temperature is a classic sign of infection, but a decreased hematocrit is not. Abrupt onset of fever is a symptom of thromboembolism, but other symptoms include dyspnea, chest pain, cough, hemoptysis, restlessness, and signs of shock. CN, physiological integrity. CNS, reduction of risk potential. CL, apply. Print page break 251. Which client is at greatest risk for dehydration? 1. A 48-year-old having intracavitary radiation for cancer of the cervix. 2. A 59-year-old 1 week after a radical vulvectomy. 3. A 67-year-old receiving adjuvant tamoxifen therapy for breast cancer. 4. A 72-year-old with a vesicovaginal fistula. 1. View answer. 8. 1. Dehydration can occur from fluid loss secondary to tissue destruction at the site of irradiation at any age. After radical vulvectomy, wound drains are generally removed by postoperative day 4 or 5 and don't create a significant risk of dehydration. Tamoxifen therapy is unrelated to dehydration. Although urine may escape through the vagina as a result of a vesico-vaginal fistula, it does not cause the loss of an unusual amount of urine or other fluid. CN, physiological integrity. CNS, physiological adaptation. CL, analyze. CEN 999, or 142.200, and 4.35.194, or 25 September 2000, and 25/3/44/23 UTC. NCLEX-RN questions and answers made incredibly easy. ISBN 9781 4963 2549-5, or 7th edition, LISCO, Dr. Susan or LISCO Susan. 9. Which client would benefit most from information explaining the importance of receiving an annual Papa Nicolau Pap test? 1. A client with a history of recurrent candidiasis. 2. A client who had her first pregnancy before the age of 20. 3. A client infected with the human papillomavirus HPV. 4. A client who has used oral contraceptives for 27 years. 1. View answer. 9. 3. HPV causes genital warts, which are associated with an increased incidence of cervical cancer. Recurrent candidiasis, pregnancy before age 20, and the use of oral contraceptives have not been shown to increase the risk of cervical cancer. CN, health promotion and maintenance. CNS, none. CL, analyze. 10. A client develops candidiasis. Which is the most likely contributor? 1. Nulliparity. 2. Menopause. 3. Use of corticosteroids. 4. Use of spermicidal jelly. 1. View answer. 10. 3. Small numbers of the fungus Candida albicans are commonly found in the vagina. Because corticosteroids suppress the immune system, they increase the risk of candidiasis. Pregnancy, not nulliparity, increases the risk of candidiasis. It is thought that higher estrogen levels and higher glycogen content in vaginal secretions during pregnancy increase a woman's risk of developing candidiasis. Candidiasis is rare before menarche or after menopause. The use of oral contraceptives, not spermicidal jelly, increases the risk of candidiasis. Oral contraceptives contain an excess in the amount of estrogen, resulting in increase of blood sugar levels, which yeast feeds on. As a result, an overgrowth of yeast occurs. CN, health promotion and maintenance. CNS, N1. CL, apply. CEN 999 or 142.200 and 445.194, or September 25, 2025, 3:44:23 UTC. NCLEX-RN questions and answers made incredibly easy. ISBN 978 to 14963 to 2549-5, or 7th edition. LISCO, Dr. Susan or LISCO Susan. 11. A client visits the clinic with a primary concern of a frothy greenish vaginal discharge. Which diagnosis does the nurse anticipate? 1. Candidiasis. 2. Gardnerella vaginalis vaginitis. 3. Gonorrhea. 4. Trichomoniasis. 1. View answer. 11. 4. The discharge associated with infection caused by Trichomonas organisms is homogeneous, greenish-gray, watery, and frothy or purulent. The discharge associated with candidiasis is thick and white in appearance. An infection due to Gardnerella vaginalis would present with a discharge that is thin and grayish-white, with a fishy odor. Gonorrhea is asymptomatic in many women, but can present with a purulent vaginal discharge. CN, physiological integrity. CNS, physiological adaptation. CL, apply. Print page break 252. 1. Teach the client how to clean the perineal area more completely. 2. Evaluate the client for an allergy to a feminine hygiene product. 3. Teach the client that this is normal. 4. Ask the client if she wears tight clothing. 1. View answer. 12. 3. The nurse should teach the client that this is a normal discharge. Vaginal fluid is clear, milky, or cloudy, depending on the fluctuating levels of estrogen and progesterone. A milky-appearing vaginal discharge is normal and is not associated with inadequate cleaning, sensitivity, or a reaction to heat or moisture. CN, Health Promotion and Maintenance, CNS, none, CL, apply. 13. What is the priority nursing intervention for a client in the immediate postoperative stage following breast? SEN 999 or 142.200 and 4.35.194 or 25 September 2000 and 25/3/44/23 UTC. NCLEX-RN questions and answers made incredibly easy. ISBN 9781 4963 2549-5 or 7th edition Lisco, Dr. Susan or Lisco Susan. Reconstructive surgery. 1. Prevent hypothermia. 2. Maintain even pressure on the wound. 3. Position the client on the operative side. 4. Raise the client's arms over her head 4 times daily. 1. View answer. 13. 1. Hypothermia causes a decrease in surface circulation. This can lead to ischemia of the skin or muscle graft, and ultimately to tissue necrosis in clients who had breast reconstruction surgery. Maintaining good circulation is crucial, and pressure on the breast wound must be avoided. The client should be positioned on her back or on her non-operative side. Arms should not be lifted above shoulder level for 4 to 6 weeks. CN, physiological integrity. CNS, reduction of risk potential. CL, apply. 14. A client who had intracavitary radiation treatment for cancer of the cervix 1 month ago reports small amounts of vaginal bleeding. This client is most likely experiencing 1. Recurrence of the carcinoma. 2. Development of a rectovaginal fistula. 3. Expected effect of the radiation therapy. 4. Infection secondary to a change in vaginal flora. 1. View answer. 14. 3. After intracavitary radiation, some vaginal bleeding occurs for 1 to 3 months following treatment. Intermittent, painless vaginal bleeding is a classic symptom of cervical cancer, but given this client's history, the bleeding is more likely a result of the radiation than recurrent cancer. The passage of feces through the vagina is a sign of rectovaginal fistula. Vaginal infections show various types of vaginal discharge, but not vaginal bleeding. CN, physiological integrity. CNS, physiological adaptation. CL, apply. SEN 999 or 142.200 and 4.35.194 or 25 September 2000 and 25/3/44/23 UTC. NCLEX-RN questions and answers made incredibly easy. ISBN 9781 4963 2549-5 or 7th edition Lisco, Dr. Susan or Lisco Susan. 15. A nurse enters the room of a client who had a left-modified mastectomy 8 hours ago. Which assessment finding requires further intervention? 1. The client is squeezing a ball in her left hand. 2. The client is wearing a robe with tight elastic cuffs. 3. The client's affected arm is elevated on a pillow. 4. A blood pressure cuff is on the client's right arm. 1. View answer. 15. 2. Elastic cuffs can contribute to the development of lymphedema and should be avoided. Simple exercises such as squeezing a ball help promote circulation and should be started as soon as possible after surgery. Elevation of the affected arm promotes venous and lymphatic return from the extremity. Blood pressure measurements in the affected arm should also be avoided. CN, Safe Effective Care Environment, CNS, Management of Care, CL Analyze. Print page break 253. 16. The client has a wound dehiscence and is at risk for evisceration. For which should the nurse assess this client? 1. Tachycardia accompanied by a weak, thready pulse. 2. Hypotension with a decreased level of consciousness, lock. 3. Shallow, rapid respirations and increasing vaginal drainage. 4. Low-grade fever with increasing serosanguineous incisional drainage. 1. View answer. 16. 4. Evisceration. The protrusion of wound contents may occur as a result of dehiscence and is a serious complication. Signs of impending evisceration are a low-grade fever and increasing serosanguineous drainage, tachycardia, a weak, thready pulse, hypotension, decreased LOC, shallow respirations, and vaginal drainage are all unrelated to impending evisceration, but may be. SEN 999, or 142.200, and 4.35.194, or 25 September 2000, and 25/3/44/23 UTC. NCLEX-RN questions and answers made incredibly easy. ISBN 9781 4963 2549-5, or 7th edition, Lisco. Dr. Susan or Lisco Susan. Associated with other serious problems such as shock. CN, physiological integrity. CNS, reduction of risk potential, CL, apply. 17. Oxycodone is being administered to a client with metastatic breast cancer, which assessment finding indicates that this medication is having a therapeutic effect. 1. Bone density is increased. 2. Pain is 0 to 2 on a 10-point scale. 3. Alpha-fetoprotein level is decreased. 4. Serum calcium level is within normal range. 1. View answer. 17. 2. Oxycodone is an opioid analgesic used for alleviating severe pain, especially in terminal illness. If a client's pain has decreased to 0 to 2 on a 10-point scale, the medication is having a therapeutic effect. This medication does not directly affect bone density, alpha-fetoprotein level, or serum calcium level. CN, physiological integrity. CNS, pharmacological and parenteral therapies. CL, analyze. 18. Which instructions should the nurse give to a client with prostatitis who is receiving double-strength cotrimoxazole? 1. Don't expect improvement of symptoms for 7 to 10 days. 2. Drink 6 to 8 glasses of fluid daily while taking this medication. 3. If a sore mouth or throat develops, take the medication with milk or an antacid. 4. Use a sunscreen of at least SPF 15 with para-aminobenzoic acid, PABA. 1. View answer. 18. 6 to 8 glasses of fluid daily are needed to prevent renal problems such as crystalluria and stone formation. The symptoms should improve in a few days if the drug is effective. Sore throat and sore mouth are adverse effects that should be reported right away. The drug causes photosensitivity, but a PABA-free sunscreen should be used because PABA can interfere. SEN 999, or 142.200, and 4.35.194, or 25 September 2000, and 25/3/44/23 UTC. NCLEX-RN questions and answers made incredibly easy. ISBN 9781 4963 2549-5, or 7th edition, Lisco. Dr. Susan or Lisco Susan. With the drug's action. CN, physiological integrity. CNS, pharmacological and parenteral therapies. CL, apply. 19. What is the most important assessment for the nurse to make when administering tamsulosin to a client with benign prostatic hyperplasia BPH? 1. Voiding pattern. 2. size of the prostate. 3. Creatinine clearance. 4. Serum testosterone level. 1. The alpha-adrenergic blocker. Tamsulosin relaxes the smooth muscle of the bladder, neck, and prostate, so the urinary voiding symptoms of BPH are reduced in many clients. These drugs do not affect the size of the prostate, renal function, or the production or metabolism of testosterone. CN, physiological integrity, CNS, pharmacological and parenteral therapy, CL, apply. Remember, alpha-adrenergic blockers get rid of hypertension by relaxing smooth muscle and blood vessels, increasing dilation of blood vessels, decreasing blood pressure. Alpha-adrenergic blockers include the following drugs: phentolamine, prazosin, doxazosin, terazosin. 20. The nurse is assigned 4 clients. Which client is at highest risk for impaired skin integrity? 1. A client with endometriosis. 2. A client taking oral contraceptives. 3. A client with a vaginal packing in place. 4. A client having reconstructive breast surgery. 1. View answer. SEN 999 or 142.200 and 4.35.194 or September 25, 2025, 3:44:23 UTC. NCLEX-RN questions and answers made incredibly easy. ISBN 978-1 4900 and 63-2549-5 or 7th edition. Lisco, Dr. Susan or Lisco Susan. 20. 4. Reconstructive breast surgery places the client at risk for insufficient blood supply to the muscle graft and skin, which can lead to tissue necrosis. Endometriosis and oral contraceptives aren't generally associated with altered tissue perfusion. Pressure from vaginal packing can sometimes put pressure on the bladder neck and interfere with voiding. CN, physiological integrity. CNS, reduction of risk potential. CL, analyze. Print page break 254. A client is diagnosed with priapism. What condition is the client at risk for developing? 1. Disseminated intravascular coagulation, DIC. 2. Hydronephrosis. 3. Penile gangrene. 4. Testicular atrophy. 1. View answer. 21. 3. Priapism is a condition in which the penis is persistently erect and painful. It's a urological emergency because gangrene, secondary to ischemia, can result if venous drainage of the corpora cavernosa does not occur. Priapism does not cause DIT, hydronephrosis, or testicular atrophy. CN, physiological integrity. CNS, reduction of risk potential. CL, apply. 22. The nurse is teaching a client how to decrease their risk for toxic shock syndrome. What is the best information for a nurse to share? 1. Avoid douching. 2. Wear loose cotton underwear. 3. Use pads, not tampons. 4. Avoid sexual intercourse during menses, SEN 999 or 142.200 and 4.35.194 or September 25, 2025, 3:44:23 UTC. NCLEX-RN questions and answers made incredibly easy. ISBN 9781 4963 2549-5 or 7th edition. Lisco, Dr. Susan or Lisco Susan. 22. 3. The cause of toxic shock syndrome is a toxin produced by Staphylococcus aureus bacteria. It most commonly occurs in menstruating women who use tampons. Tampons, particularly when left in place for more than 8 hours, are believed to provide an ideal environment for bacterial growth. The bacteria then enters the bloodstream through breaks in the vaginal mucosa. Douching, use of loose cotton underwear, and sexual intercourse during menstruation have no direct association with toxic shock syndrome. CN, health promotion and maintenance. CNS, none. CL, analyze. 23. The nurse is reviewing discharge instructions for a client who had a dilation and curettage procedure. Which statement should the nurse include in the discharge instructions? 1. Tampons may be used during exercise. 2. Avoid strenuous work and sexual intercourse for at least 2 weeks. 3. Stay on bed rest for 3 days, then gradually resume normal activity. 4. Take a soaking tub bath each day to promote relaxation. 1. View answer. 23. 2. Strenuous work, which can result in increased bleeding, should be avoided for 2 weeks to allow time for healing. Sexual intercourse should also be avoided for 2 weeks to allow healing and decrease the risk of infection. Tampons and tub baths should be avoided for 1 week. Overall activity should be gradually resumed, reaching preoperative levels within 2 weeks. Bed rest and other restrictions aren't usually necessary. CN, physiological integrity. CNS, reduction of risk potential. CL, apply. 24. Which assessment finding is expected in a client receiving bicalutamide and leprolide for advanced prostate cancer? 1. Abdominal distension. 2. Acromegaly. 3. Colicky pain. 4. Hot flashes. 1. View answer. 24. 4. Bicalutamide, a nonsteroidal anti-androgen, and leprolide, a gonadotropin-releasing hormone agonist, decrease the production of testosterone. This helps decrease the production of cancer cells involved in prostate cancer. Because androgens are responsible for the development of male genitalia and secondary male sex characteristics, low androgen levels can cause genital atrophy, breast enlargement, and hot flashes. Abdominal distension, acromegaly, and colicky pain aren't caused by bicalutamide and leprolide therapy. CN, physiological integrity. CNS, pharmacological and parenteral therapies. CL, analyze. 25. Which assessment finding is abnormal in a 72-year-old male client? 1. Increased sperm count. 2. Small firm testes on palpation. 3. History of slowed sexual response. 4. Decreased plasma testosterone level. SEN 999, or 142.200 and 4.35.194. Or September 25, 2025, 3:44:23 UTC. NCLEX-RN questions and answers made incredibly easy. ISBN 978-1 4963 to 2549, 517th edition, Lisco Dr. Susan or Lisco Susan. 25. 1. Sperm continues to be produced as a male ages, however, the rate of sperm cell production slows. Decreased size and increased firmness of the testes, a decrease in sexual potency, and decreased production of testosterone and progesterone are normal age-related changes. CN, physiological integrity. CNS, physiological adaptation. CL, apply. Print page break 255. A client is being treated for chronic prostatitis. Which comment indicates to the nurse that further teaching is necessary? 1. I miss not being able to have sex. 2. I enjoy soaking in a hot tub of water. 3. Cutting down on coffee hasn't been as hard as I expected. View answer. 26. 1. Ejaculation can aid in the treatment of chronic prostatitis by decreasing the retention of prostatic fluid. Coffee should be eliminated from the diet because it can increase prostate secretion. Warm sitz baths and not sitting for long periods at a time promote comfort. CN, physiological integrity. CNS, physiological adaptation. CL, apply. SEN 999, 142.200 and 4.35.194. 25. September 2025, 3:44:23 UTC. NCLEX-RN questions and answers made incredibly easy. ISBN 978-1 4963 to 2549-5 or 7547. A male client reports perineal pain without any observable cause. What condition does the nurse suspect? 1. Endometriosis. 2. Internal hemorrhoids. 3. Prostatitis. 4. Renal calculus. 1. View answer. 27. 3. Prostatitis can cause prostate pain, which is felt as perineal discomfort. Endometriosis can cause pain low in the abdomen, deep in the pelvis, or in the rectal or sacrococcygeal area, depending on the location of the ectopic tissue. Hemorrhoids cause rectal pain and pressure. Renal calculi typically produce flank pain. CN, health promotion and maintenance, CNS, NN, CL, analyze. 1. Azotemia. 2. Breast enlargement. 3. Decreased prostate size. 4. Flushing. 1. View answer. 28. 1. Azotemia, a buildup of nitrogenous waste products in the blood, indicates impaired renal function. Finasteride, an anti-androgenic agent, is prescribed for chronic urinary retention secondary to benign prostatic hypertrophy BPH. Azotemia, in a client on finasteride therapy, can indicate that the drug is not effective in relieving the urinary symptoms associated with BPH, or that an unrelated renal problem has occurred. Breast enlargement, decrease in prostate size, and flushing are expected effects of finasteride. CN, physiological integrity, CNS, pharmacological and parenteral therapies, CL, apply. CEN 999, or 142.200, and 4.35.194, or 25 September 2000, and 25/3/44/23 UTC. NCLEX-RN questions and answers made incredibly easy. 978 to 14963 to 2549 minus 547,549. A client with cervical polyps has been treated with cryosurgery. What would be the best nursing intervention? 1. Daily douche. 2. Oral antibiotics. 3. Intravaginal antibiotic cream. 4. Use of tampons for 72 hours. 1. View answer. 29. 3. Intravaginal antibiotic cream is commonly used to aid healing and prevent infection. Oral antibiotics are used for clients with acute cervicitis or perimetritis. Douching and tampons are generally avoided for 2 weeks following cryotherapy. CN, physiological integrity. CNS, reduction of risk potential, CL, apply. 30. A client is having intracavitary radiation for cancer of the cervix. What would be an appropriate nursing intervention? 1. High residue diet. 2. Fowler's position when in bed. 3. Intermittent urinary catheterization. 4. Bed rest. 1. View answer. 30. 4. Clients having intracavitary radiation therapy will be on strict bed rest, with the head of the bed elevated no more than 10 to 15 degrees to avoid displacing the radiation source. A low residue diet is used to prevent diarrhea during treatment. Placing the client in Fowler's position while in bed is incorrect. An indwelling urinary catheter, not intermittent urinary catheterization, is used to prevent urine from distending the bladder and changing the position of tissues relative to the radiation source. CEN 999, or 142.200, and 4.35.194, or 25 September 2000, and 25/3/44/23 UTC. NCLEX-RN questions and answers made incredibly easy. 978 to 14963 to 2549 minus 547,540. CN, physiological adaptation, CL, analyze. Print page break 256. 1. The client with Bartholinitis. 2. The client with candidiasis. 3. The client with chlamydia. 4. The client with endometriosis. 1. View answer. 31. 3. Chlamydia is a common sexually transmitted disease. for which all sexual partners need identified for treatment to prevent reinfection. Bartholinitis results from obstruction of a duct. Sexual partners may become infected, and affected men can usually be treated with over-the-counter products. Candidiasis is a yeast infection that typically occurs as a result of antibiotic usage. Endometriosis occurs when endometrial cells are seeded throughout the pelvis and is not a sexually transmitted disease. CN, health promotion and maintenance. CNS, none. CL, apply. 32. What is the most important information for the nurse to include when teaching a client about metronidazole? 1. Breathlessness and cough are common adverse effects. 2. Urine may develop a greenish tinge while the client is taking this drug. 3. Mixing this drug with alcohol causes severe nausea and vomiting. 4. Heart palpitations may occur and should be immediately reported. 1. View answer. CN, physiological integrity. CNS, pharmacological and parenteral therapies. CL, apply. CEN 999. Or 142.200 and 4.35.194 or 25 September 2000 and 25/3/44/23 UTC. NCLEX-RN questions and answers made incredibly easy. 978 to 14963 to 2549 minus 5 or 7540. Hydrocodone with acetaminophen has been prescribed for a client with metastatic prostate cancer. What information is essential for the nurse to include in the teaching plan? 1. You may develop blurred vision. 2. Constipation may develop with constant use. 3. You may feel more relaxed and calm. 4. Nausea may occur. 1. View answer. 33. 2. Constipation commonly develops with constant use of hydrocodone. The nurse should teach the client about constipation and tell the client ways to decrease this risk, such as increasing fiber and liquids in the diet. Nausea may occur on occasion, however, it is not a severe problem and could be related to constipation. Blurred vision and diarrhea are not associated with the use of hydrocodone with acetaminophen. Feeling relaxed and calm is a common side effect, does not need medical attention. As the body adjusts to the medicine during treatment, these side effects may go away. CN, physiological integrity. CNS, pharmacological and parenteral therapies. CL, apply. 34. The nurse is planning care for a client having a hysterosalpingography. What is the most important intervention for the nurse to provide? 1. Give the client a perineal pad to wear after the procedure. 2. Give the client nothing by mouth after midnight the night before the procedure. 3. Position the client in the knee-chest position during the procedure. 4. Keep the client in a dorsal recumbent position for 4 hours after the procedure. 1. View answer. 34. 1. A perineal pad is needed after hysterosalpingography because the contrast medium may leak from the vagina for several hours and stain the clothing. The bowel needs to be cleaned before the procedure, but the client does not have to refrain from having anything by mouth after midnight. The procedure is performed with the client in the lithotomy position and no special. CEN 999. Or 142.200 and 4.35.194 or 25 September 2000 and 25/3/44/23 UTC. NCLEX-RN questions and answers made incredibly easy. 978 to 14963 to 2549 minus 5 or 7540 F. Physiological integrity. CNS, basic care and comfort. CL, apply. Print page break 257, 35. The nurse is instructing a client with vulvovaginal candidiasis on the use of the prescribed nystatin vaginal tablets. Which statement indicates that the client requires additional teaching? 1. I will need to refrigerate the nystatin tablets. 2. I can get up to do other activities after inserting the medicine. 3. I will finish all the tablets even if I am feeling better. 4. I should report increased skin irritation to my doctor. 1. View answer. 35. 2. The client will need to lay down for at least 30 minutes after insertion of the vaginal tablets. Refrigerating nystatin tablets, finishing all the tablets, and reporting increased skin irritation to the healthcare provider are all important interventions concerning this medication. CN, physiological integrity, CNS, pharmacological and parenteral therapies, CL, apply. 36. A 36-year-old client who never had the measles, mumps, and rubella MMR immunization reports that a child with whom he recently stayed has been diagnosed with mumps. Which treatment should the client receive? 1. Intravenous antibiotics. 2. The MMR vaccine. 3. Application of a scrotal support. 4. Administration of gamma globulin. 1. View answer. 36. 4. Gamma globulin provides passive immunity to mumps. Antibiotic therapy is used in the treatment of bacterial orchitis. Ice and the use of a scrotal support are used as comfort measures in the treatment of orchitis. The client should not receive the MMR vaccine at this point in time. CN, Health Promotion and Maintenance, CNS, N1, CL, apply. 37. A client scheduled for a vasectomy. Which statement by the client indicates that further teaching is required? 1. I'm glad I won't have to worry about contraception as soon as this procedure is done. 2. I'll need to place an ice pack over the incision several times a day when I first go home. 3. I know this procedure can be reversed, but the success rate is low. 4. I'll have to limit my usual activities for about 1 week. 1. View answer. 37. 1. After vasectomy, the client remains fertile for several weeks until sperm stored distal to the severed vas deferens are evacuated. After this occurs, sperm are still produced, but they do not enter the ejaculate and are absorbed by the body. The other statements are accurate. SEN 999 or 142.204.35.194 or September 25, 2025, 3:44:23 UTC. NCLEX-RN questions and answers made incredibly easy. ISBN 978-14549-547-540 Physiological adaptation, CL, analyze. 38. What should the nurse teach an uncircumcised client to prevent phimosis? 1. Proper cleaning of the prepuce. 2. Importance of regular ejaculation. 3. Technique of testicular self-examination. 4. Proper hand washing before touching the genitals. 1. View answer. 38. 1. Proper cleaning of the preputial area to remove secretions is critical to the prevention of non-congenital phimosis. Regular ejaculation can decrease the symptoms of chronic prostatitis, but it has no effect on the development of phimosis. Testicular self-examination is important in the early detection and treatment of testicular cancer, but is unrelated to phimosis. Hand washing is important in preventing the spread of infection. CN, Health Promotion and Maintenance, CNS, none, CL, apply. Print page break 258. What is the most accurate information a nurse can teach a newly diagnosed client with testicular cancer? 1. Testicular cancer isn't responsive to chemotherapy, but it is highly curative with surgery. 2. Radiation therapy is never used, so the unaffected testicle remains healthy. 3. Testicular self-examination is important because there is an increased risk for a second tumor. 4. Taking testosterone after orchiectomy prevents changes in appearance and sexual function. 1. View answer. 39. 3. A history of a testicular malignancy puts the client at increased risk for a second tumor. Testicular self-examination allows for early detection and treatment. Chemotherapy is added for clients who have evidence of metastasis after irradiation. Radiation therapy is used on the retroperitoneal lymph nodes. Testosterone usually is not needed because the unaffected testis usually produces sufficient hormone. CN, physiological integrity. CNS, reduction of risk potential. CL, apply. SEN 999 or 142.200 and 4.35.194 or September 25, 2025, 3:44:23 UTC. NCLEX-RN questions and answers made incredibly easy. 978 to 1, 4,963 to 2,549. 517th edition, LISCO Dr. Susan or LISCO Susan. You can ease your client's worries through effective teaching efforts. 40. The nurse is teaching a client about penile hygiene. What is the most important information for the nurse to include? 1. Use warm water without soap. 2. Dry all areas of the penis thoroughly. 3. Wash from the base of the shaft to the tip. 4. Avoid retracting the foreskin if not circumcised. View answer. 40. 2. Careful drying is essential to avoid maceration of the penis. To decrease the risk of genitourinary infection, wash the penis from the tip to the base to reduce the risk of introducing pathogens into the urethral meatus. Effective cleaning requires soap and thorough rinsing. It is also essential to remove secretions that accumulate under the foreskin because they can lead to inflammation and are associated with the development of penile cancer. The foreskin in uncircumcised men must be retracted for cleaning and then replaced to prevent paraphimosis. CN, health promotion and maintenance. CNS, N1, CL, apply. SEN, 999,142.200 and 4.35 when 194. 25. September 2025, 3:44, 23 ULC. NCLEX-RN questions and answers made incredibly easy. ISBN 978 to 1, 4,963 to 2,549 minus. 5 or 7th edition LISCO Dr. Susan or LISCO Susan. 41. A client underwent an orchiectomy for testicular cancer and now has a persistent elevation in alpha-fetoprotein levels. Which statement by the nurse is most accurate? 1. You are still fertile. 2. This is related to the surgical procedure. 3. You need further testing to determine the cause of this elevation. 4. When testosterone decreases, alpha-fetoprotein increases. 1. View answer. 41. 3. Alpha-fetoprotein is a tumor marker elevated in non-seminomatous malignancies of the testicle. After the tumor is removed, the level should decrease. A persistent elevation after orchiectomy may indicate that a tumor may still be present outside the testicle that was removed. The nurse should tell the client that further testing is necessary. The level of alpha-fetoprotein is not related to fertility or testosterone level. A recurrence of the cancer is indicated by a post-surgical decrease in alpha-fetoprotein level followed by an elevation as a new tumor starts to grow. CN, physiological integrity. CNS, physiological adaptation. CL, analyze. 42. Which discharge instruction should the nurse give to a client after a prostatectomy? 1. Avoid straining at stool. 2. Report clots in the urine right away. 3. Soak in a warm tub daily for comfort. 4. Return to your usual activities in 3 weeks. 1. View answer. 42. 1. Straining at stool after prostatectomy can cause bleeding. Small blood clots or pieces of tissue are commonly passed in the urine for up to 2 weeks postoperatively. Tub baths are prohibited because they cause dilation of pelvic blood vessels. Other activities are resumed based on the guidance of the healthcare provider. Sexual intercourse and driving are usually prohibited for about 3 weeks. Exercising and returning to work are usually prohibited for about 6 weeks. CN, physiological integrity. CNS, reduction of risk potential, CL, apply, send 999 or 142.200 and 4.35.194, or September 25, 2025, 3:44:23 UTC. NCLEX-RN questions and answers made incredibly easy. ISBN 978 to 14963 to 2549 minus 547 Print page break 259. 43. Which symptoms should the nurse instruct a client to report following a biopsy of the prostate? 1. Pain on the following day. 2. Discolored semen. 3. Difficulty urinating. 4. Temperature greater than 99 degrees Fahrenheit, 37.2 degrees Celsius. 1. View answer. 43. 3. Difficulty urinating suggests urethral obstruction. Mild pain is expected for 1 to 3 days after the biopsy. Semen may be discolored for up to a month after the biopsy. Temperature higher than 101 degrees Fahrenheit, 38.3 degrees Celsius should be reported because it suggests infection. CN, physiological integrity, CNS, reduction of risk potential, CL, analyze. 44. 2 days after a transrectal biopsy of the prostate, the client calls the clinic to report that his stool is streaked with blood. Which response by the nurse is appropriate? 1. Tell the client to take a laxative. 2. Tell the client to come in for examination. 3. Reassure the client that this is an expected occurrence. 4. Ask the client to collect a stool specimen for testing. 1. View answer. 44. 3. After a transrectal prostatic biopsy, blood in the stool is expected for a number of days. Because blood in the stool is expected, testing the stool or examining the client isn't necessary. Stool softeners are prescribed if the client reports constipation. Straining at stool can precipitate bleeding, but laxatives generally are not necessary. CN, physiological integrity, CNS, reduction of risk potential, CL, apply, send 999 or 142.200 and 4.35.194, or September 25, 2025, 3:44:23 UTC. NCLEX-RN questions and answers made incredibly easy. ISBN 978 to 14963 to 2549 minus 547 45. A nurse is caring for clients who have a history of genital herpes infection. Which client is most at risk for an outbreak of genital herpes? 1. A client who reports headache and fever. 2. A client who reports vaginal and urethral discharge. 3. A client who reports dysuria and lymphadenopathy. 4. A client who reports genital pruritus and paresthesia. 1. View answer. 45. 4. Pruritus and paresthesia, as well as redness of the genital area, are prodromal symptoms of recurrent herpes infection. These symptoms occur 30 minutes to 48 hours before the lesions appear. Headache and fever are symptoms of viremia associated with the primary infection. Vaginal and urethral discharge are also a local sign of primary infection. Dysuria and lymphadenopathy are localized symptoms of a primary infection that may also occur with recurrent infection. CN, physiological integrity, CNS, physiological adaptation, CL, analyze. 46. Which instruction should the nurse give to a female client newly diagnosed with genital herpes? 1. Obtain a Papa Nicolau Pap test every year. 2. Have your partner use a condom when lesions are present. 3. Use a water-soluble lubricant for relief of pruritus. 4. Limit stress and emotional upset as much as possible. 1. View answer. 46. 4. Stress, anxiety, and emotional upset seem to cause recurrent outbreaks of genital herpes. Because a relationship has been found between genital herpes and cervical cancer, a Pap test is recommended every 6 months. Sexual intercourse should be avoided during outbreaks. and a condom should be used between outbreaks. It is unknown if the virus can be transmitted at this time. During an outbreak, creams and lubricants should be avoided because they may prolong healing. CN, physiological integrity; CNS, physiological adaptation; CL, apply. CEN 999, or 142.200, and 4.35.194, or 25 September 2000, and 25/3/44/23 UTC. NCLEX-RN questions and answers made incredibly easy. 978 to 14963 to 2549 minus 5 or 7,547. A client newly diagnosed with genital herpes is crying and wringing her hands as the nurse approaches her. What is the priority nursing intervention? 1. Assess the client's pain. 2. Teach the client about genital herpes. 3. Assess the client's anxiety level. 4. Ask the client about her significant other. 1. View answer. 47. 3. The client is demonstrating anxiety. This problem needs to be incorporated into the plan of care. The client is not demonstrating a pain response or require teaching at this point. This would not be an appropriate time to ask the client about her significant other. When anxiety is high, the client is unable to focus on other things such as teaching. CN, psychosocial integrity; CNS, none; CL, apply. Print page break 260. 48. A client is describing how she palpates her breasts for breast self-examination. Which statement indicates a need for further teaching? 1. I put lotion on my breasts before I begin to palpate them. 2. I palpate both breasts standing up and then lying on my back. 3. I'm careful to only palpate under each arm and up to 2 inches below my collarbone. 4. I start at the outer edge of the breast and work into the nipple in smaller and smaller circles. 1. View answer. 48. 3. Breast self-examination requires palpation of all breast tissue. This includes checking the area above the breast up to the collarbone, over to the shoulder, as well as between the breast and the underarm, including the underarm itself. Lotion or powder helps the fingers glide over the skin and facilitates palpation. Breasts should be palpated in both standing and lying positions. Any pattern of palpation may be used in performing breast self-examination as long as each quadrant of the breast, tail, and axilla are. CEN 999, or 142.200, and 4.35.194, or 25 September 2000, and 25/3/44/23 UTC. NCLEX-RN questions and answers made incredibly easy. 978 to 14963 to 2549 minus 5 or 7,540. Examined. CN, health promotion and maintenance; CNS, none; CL, apply. 49. During a routine physical examination, a firm mass is palpated in the right breast of a 35-year-old client, which finding suggests cancer of the breast rather than fibrocystic disease. 1. Mass located in upper, outer quadrant. 2. Cyclic change in mass size. 3. History of anovulatory cycles. 4. Increased vascularity of the breast. 1. View answer. 49. 4. Increase in breast size or vascularity is consistent with cancer of the breast. Masses associated with fibrocystic disease of the breast are firm, most commonly located in the upper outer quadrant of the breast, and increase in size prior to menstruation. They may be bilateral and are typically well demarcated and freely movable. CN, health promotion and maintenance; CNS, none; CL, apply. 50%. Which client does the nurse evaluate as having the highest risk of developing a postoperative wound infection? 1. A post-surgical client following a radical prostatectomy. 2. The client who had a perineal prostatectomy. 3. A post-surgical client following a suprapubic prostatectomy. 4. The client who had a transurethral resection of the prostate. 1. View answer. Sen 999 or 142.204.35.194. Or September 25, 2025, 3:44:23 UTC. NCLEX-RN questions and answers made incredibly easy. 978 to 14963 to 2549 minus 5 or 7540 cause infection if introduced into other areas of the body. Therefore, a perineal incision can become contaminated more easily than those of the other procedures. CN, physiological integrity, CNS, reduction of risk potential, CL, analyze. 51. A client with pneumonia requires mechanical ventilation and is being transferred to the intensive care unit. Blood pressure is 70/40ths mmHg, heart rate is 115 BPM, and respiratory rate is 32 breaths min using accessory muscles. Intravenous fluids are infusing at 150 milliliters HR. Urinary output has been 50 milliliters for the past 4 hours. This client is most at risk for 1. Postrenal failure, 2. Prerenal failure, 3. Intrarenal failure, 4. Dehydration. 1. View answer. 51. 2. Prerenal refers to renal failure due to an interference with renal perfusion. Decreased cardiac output causes a decrease in renal perfusion, which leads to a lower glomerular filtration rate. There is no indication that this client has a problem that would indicate post-renal failure or intrarenal failure. The infusion of fluid would prevent dehydration. CN, physiological integrity, CNS, physiological adaptation, CL, analyze. 52. A client admitted for acute pyelonephritis is about to start antibiotic therapy. Which symptom would the nurse expect this client to present? 1. Hypertension. 2. Flank pain on the affected side. 3. Bradycardia. 4. Inability to walk. 1. View answer. 52. 2. The client may report pain on the affected side because the kidney is enlarged and might have formed an abscess. Hypertension is associated with chronic pyelonephritis. The client would have tenderness with deep palpation over the costovertebral angle. Tachycardia would be expected with pain, not bradycardia. The client may have pain when walking, but should still be able to walk. CN, physiological integrity, CNS, physiological adaptation, CL, apply. Print page break, 261. 53. The nurse is providing discharge instructions for a client treated for acute pyelonephritis. What is the most important information for the nurse to include? 1. Avoid taking any dairy products. 2. Return for follow-up urine cultures. 3. Stop taking the prescribed antibiotics when the symptoms subside. 4. Recurrence is unlikely because you've been treated with antibiotics. 1. View answer. Sen 999 or 142.204.35.194. Or September 25, 2025, 3:44:23 UTC. NCLEX-RN questions and answers made incredibly easy. 978 to 14963 to 2549 minus 5 or 7540. 53. 2. The client needs to return for follow-up urine cultures because bacteriuria may be present but asymptomatic. Intake of dairy products won't contribute to pyelonephritis. Antibiotics need to be taken for the full course of therapy regardless of symptoms. Pyelonephritis typically recurs as a relapse or new infection within 2 weeks of completing therapy. CN, health promotion and maintenance, CNS, N1, CL, apply. 54. A client reports severe flank and abdominal pain. A flat plate of the abdomen shows urolithiasis. Which intervention does the nurse determine is appropriate? 1. Strain all urine. 2. Limit fluid intake. 3. Enforce strict bed rest. 4. encourage a high calcium diet? 1. View answer. 54. 1. Urine should be strained for calculi and sent to the laboratory for analysis. Fluid intake of 3 to 4 qt, 3 to 4 Albanian lex per day is encouraged to flush the urinary tract and prevent further calculi formation. Ambulation is encouraged to help pass the calculi through gravity. A low-calcium diet is recommended to help prevent the formation of calcium calculi. CN, physiological integrity. CNS, reduction of risk potential, CL apply. 55. A client is receiving a radiation implant for the treatment of bladder cancer. Which nursing intervention is most appropriate? 1. Flush all urine down the toilet. 2. Restrict the client's fluid intake. 3. Place the client in a semi-private room, SEN 999, or 142.200 and 4.35.194, or September 25, 2025, 3:44, 23 UTC. NCLEX-RN questions and answers made incredibly easy. 978 to 14963 to 2549 minus 5 or 7,540. 4. Monitor the client for signs and symptoms of cystitis. 1. View answer. 55. 4. Cystitis is the most common adverse reaction of clients undergoing radiation therapy. Symptoms include dysuria, frequency, urgency, and nocturia. Urine of clients with radiation implants should be sent to the radioisotopes laboratory for monitoring. It is recommended that fluid intake be increased. Clients with radiation implants require a private room. CN, physiological integrity. CNS, physiological adaptation. CL, apply. 56. The nurse is assessing a client who has undergone a radical cystectomy and ileal conduit for the treatment of bladder cancer. Which finding would prompt the nurse to provide immediate intervention? 1. A red moist stoma. 2. A dusky-colored stoma. 3. Urine output more than 30 milliliters HR. 4. Slight bleeding from the stoma when changing the appliance. 1. View answer. 56. 2. The stoma should be red and moist, indicating adequate blood flow. A dusky or cyanotic stoma indicates insufficient blood supply and requires prompt intervention. Urine output less than 30 milliliters HR or no urine output for more than 15 minutes should be reported. Slight bleeding from the stoma when changing the appliance may occur because the intestinal mucosa is fragile. CN, physiological integrity. CNS, reduction of risk potential, CL, apply. 57. The nurse is providing instruction about skin care at the stoma site for a client with an ileal conduit. What is the most important information for this nurse to provide? 1. Change the appliance at bedtime, SEN 999, or 142.204.35.194, or September 25, 2025, 3:44:23 UTC. NCLEX-RN questions and answers made incredibly easy. ISBN 978 to 14963 to 2549 minus 5 or 7th edition. Lisco Dr. Susan or Lisco Susan. 2. Leave the stoma open to air while changing the appliance. 3. Clean the skin around the stoma with mild soap and water and dry it thoroughly. 4. Cut the faceplate or wafer of the appliance no more than 4 mm, larger than the stoma. 1. View answer. 57. 3. Cleaning the skin around the stoma with mild soap and water and drying it thoroughly helps keep the area free of urine, which can irritate the skin. The appliance should be changed in the early morning when urine output is low to decrease the amount of urine in contact with the skin. The stoma should be covered with a gauze pad when changing the appliance to prevent urine from contacting the skin. The faceplate or wafer of the appliance should not be more than 3 mm, larger than the stoma to reduce the skin area in contact with urine. CN, physiological integrity. CNS, basic care and comfort. CL, apply. Print page break 262. 58. What is the most important information for the nurse to include when teaching a male client diagnosed with overflow incontinence? Select all that apply. 1. How to perform self-catheterization. 2. The purpose of medication therapy. 3. How to perform Kegel exercises. 4. Elimination of caffeine in the diet. 5. Increasing acidic fluids in daily diet. 1. View answer. 58. 1. 2. Overflow incontinence occurs when the detrusor muscle fails to contract. The bladder becomes overdistended. Causes for the underactive bladder may or may not be determined. An alpha-adrenergic blocker medication may be used for male clients with an enlarged prostate to relax the muscle at the base of the urethra and allow urine to pass. Self-catheterization may also be needed to empty the bladder. Kegel exercises are not utilized by men with this problem. Caffeine is not thought to be a cause of this condition, and acidic fluids are not thought to be a cure. CN, Health Promotion and Maintenance, CNS, N1, CL, apply. 59. When performing a physical assessment, the nurse discovers the client's urinary drainage bag lying on the bed. Based on this finding, the nurse identifies which problem as the priority. 1. Risk for infection. 2. Reflex urinary incontinence. 3. Risk for pain. 4. Potential for ruptured bladder. 1. View answer. 59. 1. Placing the drainage bag beside the client will allow the urine to flow back into the bladder, potentially causing an infection. This does not place the client at risk for incontinence or pain or a ruptured bladder. CN, Safe, Effective Care Environment. CNS, Management of Care. CL, apply. SEN 999 or 142.204.35.194 or September 25, 2025 3:44:23 UTC. NCLEX-RN questions and answers made incredibly easy. ISBN 978 to 14963 to 2549-. 5 or 7th edition. Lisco Dr. Susan or Lisco Susan. 60. A urine culture has been ordered for a male client. What information should the nurse teach the client? 1. Void in a clean container. 2. Clean the foreskin of the penis if uncircumcised before specimen collection. 3. Void into a urinal and then pour the urine into the specimen container. 4. Begin the stream of urine in the toilet and catch the urine in a sterile container midstream. 1. View answer. 60. 4. Catching urine midstream reduces the amount of contamination by microorganisms at the meatus. Voiding in a clean container is done for a random specimen, not a clean catch specimen for urine culture. When cleaning an uncircumcised male, the foreskin should be retracted and the glans penis should be cleaned to prevent specimen contamination. Voiding in a urinal does not allow for an uncontaminated specimen because the urinal isn't sterile. CN, Physiological Integrity. CNS, Reduction of Risk Potential. CL, apply. 61. A client with a history of chronic renal failure missed a scheduled dialysis treatment and is now being admitted to the hospital with pulmonary edema. The client's lab results include serum potassium 6 meters EQ at mol, serum sodium 130 MEq L mol, serum bicarbonate 18 MEq L mol. What is this client's greatest risk? 1. Hypoxemia. 2. Cardiac dysrhythmia. 3. Fluid overload. 4. Pericardial effusion. 1. View answer. The client has developed pulmonary edema, which will decrease the client's air exchange. Airway and breathing are the priority. Elevated potassium can result in cardiac dysrhythmias. Fluid overload is possible due to missing a dialysis appointment. The client needs to be dialyzed as quickly as possible. Pericardial effusion occurs in advanced heart failure, pericarditis, metastatic carcinoma, cardiac surgery, or trauma. SEN 999 or 142.204.35.194, or September 25, 2025, 3:44:23 UTC. NCLEX-RN questions and answers made incredibly easy. ISBN 978 to 14963 to 2549-5 or 7th edition, LISCO Dr. Susan or LISCO Susan. CN, physiological integrity, CNS, physiological adaptation, CL, analyze. Urine-specific gravity. 2. Electrocardiogram ECG results. 3. Mental status. 4. Blood pressure. 1. View answer. 62. 2. Acute renal failure can result in hyperkalemia, which can manifest in widening of the PR and QRS intervals on the ECG, as well as irregular heartbeats, such as premature ventricular contractions. Urine-specific gravity, mental status, and blood pressure are not a priority for this client. CN, safe, effective care environment, CNS, management of care, CL, apply. Print page break 263. 63. A client has just received a renal transplant and has started cyclosporin therapy. What is the most important information for the nurse to share with this client? 1. You may have a decreased appetite. 2. Dizziness is common. 3. Report any fever, a flushed feeling, or lethargy. 4. Report any stomach discomfort or dyspepsia. 1. View answer. 63. 3. Fever, a flushed feeling, or lethargy suggest an infection. The nurse should closely monitor these symptoms in clients taking cyclosporin because it is an immunosuppressive drug. This medication should not cause decreased appetite, dizziness, or stomach discomfort. CN, physiological integrity, CNS, pharmacological and parental therapies, CL, apply. 64. A client received a transplanted kidney 2 months ago. He's admitted to the hospital with the diagnosis of acute rejection. Which assessment findings should the nurse anticipate? 1. Hypotension. 2. Normal body temperature. 3. Decreased white blood cell WBC counts. 4. Elevated blood urea nitrogen bun and creatinine levels. 1. View answer. 64. 4. A client with acute renal graft rejection will show evidence of deteriorating renal function. Elevated bun and creatinine levels are expected. The client would most likely have acute hypertension. The nurse would see fever and elevated WBC counts because the body is recognizing the graft as foreign and is attempting to fight it. CN, physiological integrity. CNS, reduction of risk potential. CL, analyze. SEN 999, or 142.200 and 4.35.194, or 25 September 2025, 3:44:23 UTC. NCLEX-RN questions and answers made incredibly easy. 978 to 14963 to 2549, 517th edition, LISCO Dr. Susan or LISCO Susan. Cyclosporin suppresses the immune system to prevent rejection of a transplanted organ. This puts the client at risk for 65. A client is diagnosed with chronic renal failure and is told to start hemodialysis. What is the priority teaching for the nurse to provide? 1. Follow a high potassium diet. 2. Strictly follow the hemodialysis schedule. 3. There will be few changes in your lifestyle. 4. Increase your fluid intake. View answer. 65. 2. To prevent life-threatening complications, the client must follow the dialysis schedule. The client should follow a low potassium diet. Because potassium levels increase in chronic renal failure, the client should know that hemodialysis is time-consuming and will cause a change in current lifestyle. The client does not need to increase fluid intake. CN, physiological integrity. CNS, reduction of risk potential. CL, apply. SEN 999. 100 and 42.200 and 4335.194 September 25, 2025 3:44:23 UTCT. NCLEX-RN questions and answers made incredibly easy. ISBN 978 to 4963 to 2549-5 or 7th edition Lisco Dr. Susan or Lisco Susan. 66. A client is to undergo kidney transplantation with a living donor. What is the most important preoperative assessment by the nurse? 1. Urine output. 2. Signs of graft rejection. 3. Signs and symptoms of infection. 4. Client's support system and understanding of lifestyle changes. 1. View answer. 66. 4. A client undergoing renal transplantation will need vigilant follow-up care and must adhere to the medical regimen. The client is most likely anuric or oliguric preoperatively. Postoperatively, this client will need to closely monitor urine output to make sure the transplanted kidney is functioning optimally. Rejection can occur postoperatively. Although the client will always need to be monitored for signs and symptoms of infection, it is a priority during the immediate postoperative period because of the initiation of immunosuppressive therapy. CN, Psychosocial Integrity, CNS, N1, CL, apply. 67. A client is undergoing peritoneal dialysis. The dialysate dwell time is completed, and the clamp is open to allow the dialysate to drain. The nurse notes 1,500 milliliter was instilled, but only 500 milliliters has drained. Which intervention should be done first? 1. Change the client's position. 2. Call the healthcare provider. 3. Assess the catheter for kinks or obstruction. 4. Clamp the catheter and instill more dialysate at the next exchange time. 1. View answer. 67. 3. The first intervention should be to check for kinks and obstructions because that could be preventing drainage. After checking for kinks, the client should change position to promote drainage. Don't give the next scheduled exchange until the SEN 999 or 142.200 and 4.35.194 or September 25, 2025 3:44:23 UTC. NCLEX-RN questions and answers made incredibly easy. ISBN 978 to 14963 to 2549-547-540. Dialysate is drained because abdominal distension will occur unless the output is within the parameters set by the healthcare provider. If unable to get more output despite checking for kinks and changing the client's position, the nurse should then call the healthcare provider to determine another intervention. CN, Physiological Integrity, CNS, Reduction of Risk Potential, CL, Analyze. Print page break 264. 68. A client receiving hemodialysis treatments arrives at the hospital with a blood pressure of 200/100 mmHg, a heart rate of 110 bpm, and a respiratory rate of 36 breaths min. Oxygen saturation on room air is 89%. The client reports shortness of breath and has +2 pedal edema. The last hemodialysis treatment was yesterday. Which intervention should be done first? 1. Administer oxygen. 2. Elevate the foot of the bed. 3. Restrict the client's fluids. 4. Prepare the client for hemodialysis. 1. View answer. 68. 1. Airway and oxygenation are always the first priority. Because the client is reporting shortness of breath and his oxygen saturation is only 89%, the nurse needs to try to increase the partial pressure of arterial oxygen by administering oxygen. The foot of the bed should not be elevated at this time, as this may increase venous return to the heart and worsen pulmonary edema. The client is in pulmonary edema from fluid overload and will need to be dialyzed and have fluids restricted. CN, Physiological Integrity, CNS, Physiological Adaptation, CL, Analyze. 69. A client with renal insufficiency is being treated with intravenous antibiotics. Which laboratory value should be monitored closely? 1. Blood urea nitrogen bun and creatinine levels. 2. Arterial blood gas ABG levels. 3. Platelet count. 4. Potassium level, SEN 999 or 142.204.35, 194, or September 25, 2025, 3:44:23 UTC. NCLEX-RN questions and answers made incredibly easy. 978 to 1,4963 to 2,549 minus 5 or 7,541. View answer. 69. 1. Bun and creatinine levels should be monitored closely to detect elevations due to nephrotoxicity. ABG determinations are inappropriate in this situation. Platelets and potassium levels should be monitored according to routine. CN, physiological integrity. CNS, reduction of risk potential. CL, analyze. 70. A client had a transurethral prostatectomy for benign prostatic hypertrophy and is currently being treated with continuous bladder irrigation. The client reports an increase in the severity of his bladder spasms. Which intervention is most important for the nurse to implement? 1. Administer an oral analgesic. 2. Stop the irrigation and call the healthcare provider. 3. Administer a belladonna and opium suppository as ordered by the healthcare provider. 4. Check for the presence of clots and make sure the catheter is draining properly. 1. View answer. 70. 4. Blood clots and blocked outflow of the urine can increase spasms. The irrigation shouldn't be stopped as long as the catheter is draining because clots will form. A belladonna and opium suppository should be given to relieve spasms per order, but only after assessment of the drainage. Oral analgesics should be given if the spasms are unrelieved by the suppository. CN, physiological integrity. CNS, physiological adaptation. CL, analyze. SEN 999 or 142.204.35.194 or September 25, 2025, 3:44:23 UTC. NCLEX-RN questions and answers made incredibly easy. ISBN 978 to 1,4963 to 2,549 minus 5 or 7th edition. Lisco Dr. Susan or Lisco Susan. 71. A client has returned from surgery with continuous bladder irrigation, which assessment finding indicates the bladder irrigation is successful. 1. The urine flow is red. 2. The irrigant flow is pink. 3. The bladder feels distended. 4. The irrigant outflow is half of the intake. 1. View answer. 71. 2. The irrigant should be infused at a rate fast enough to maintain pink urine. Red urine indicates inadequate irrigation and possible clot formation. Bladder distension should not occur as long as the system is draining properly and no clots are obstructing the outflow of urine. The outflow should be almost the same as the intake. CN, physiological integrity. CNS, physiological adaptation. CL, apply. Print page break 265. 72. A client has an indwelling urinary catheter. Urine is leaking from a hole in the collection bag. Which nursing intervention would be most appropriate? 1. Cover the hole with tape. 2. Remove the catheter and insert a new one using sterile technique. 3. Disconnect the drainage bag from the catheter and replace it with a new bag. 4. Place a towel under the bag to prevent spillage of urine on the floor, which could cause the client to slip and fall. 1. View answer. 72. 2. The system is no longer a closed system, and bacteria might have been introduced. A new sterile catheter should be inserted. Taping the hole and placing a towel under the bag leave the system open, which increases the risk of infection. Replacing the drainage bag by disconnecting the old one from the catheter opens up the entire system and increases the risk of infection. It is not recommended. Send 999 or 142.204.35.194 or September 25, 2025 3:44:23 UTC. NCLEX-RN questions and answers made incredibly easy. ISBN 978 to 14963 to 2549-5 or 7th edition, Lisco Dr. Susan or Lisco Susan. CN, Safe, Effective Care Environment. CNS, Safety and Infection Control. CL, Analyze. 73. A client is admitted with a diagnosis of hydronephrosis secondary to calculi. The calculi have been removed, and post-obstructive diuresis is occurring. What is the nurse's most important intervention? 1. Take vital signs every 8 hours. 2. Weigh the client every other day. 3. Assess the urine output every shift. 4. Monitor the client's electrolyte levels. 1. View answer. 73. 4. Post-obstructive diuresis seen in hydronephrosis can cause electrolyte imbalances. Laboratory values must be checked so electrolytes can be replaced as needed. Vital signs should initially be taken every 30 minutes for the first 4 hours and then every 2 hours. Urine output should be assessed hourly. The client's weight should be taken daily to closely monitor fluid status. CN, Physiological integrity. CNS, reduction of risk potential. CL, analyze. 74. An older adult has developed a urinary tract infection and is at risk for urosepsis. Which signs or symptoms should the nurse monitor? Select all that apply. 1. Decreased temperature. 2. Increased heart rate. 3. Decreased urinary output. 4. Increased respiratory rate. 5. Change in level of consciousness. 1. View answer. 74. 2, 3, 4, 5. Symptoms of sepsis include low-grade fever in the older adult, rapid breathing, fast heart rate, weak pulse, profuse sweating, unusual anxiety, changes in mental status or level of consciousness, and decreased or absent urinary output. CN, physiological integrity. CNS, physiological adaptation. CL, analyze. 75. What should the nurse include when prioritizing care for a client with polycystic kidney disease (PKD)? Select all that apply. 1. Pain management. 2. Prevention of infection. 3. Prevention of constipation. 4. Monitoring of electrocardiogram (ECG). 5. Monitoring of electrolytes. 1. View answer. 75. 1, 2, 3. Interventions for the client with PKD include pain management and prevention of infection, constipation, hypertension, and chronic kidney disease. Monitoring electrolytes is not necessary unless the disease progresses to kidney failure. If kidney failure is imminent, the client's ECG and electrolytes would be closely monitored. Send 999 or 142.204.35.194 or September 25, 2025 3:44:23 UTC. NCLEX-RN questions and answers made incredibly easy. ISBN 978 to 14963 to 2549-5 or 7th edition, Lisco Dr. Susan or Lisco Susan. CN, physiological integrity. CNS, physiological adaptation. CL, apply. 76. The nurse is obtaining a health history on a client. Which client statement indicates a risk of renal calculi? 1. I've been drinking a lot of cola soft drinks lately. 2. I've been jogging more than usual. 3. I've had more stress since we adopted a child last year. 4. I'm a vegetarian and eat cheese 2 or 3 times each day. 1. View answer. 76. 4. Renal calculi are commonly composed of calcium. Diets high in calcium may predispose a person to renal calculi. Milk and dairy are high in calcium. Soft drinks don't contain ingredients that would increase the risk of renal calculi. Jogging and increased stress are not considered risk factors for renal calculi formation. CN, health promotion and maintenance. CNS, none. CL, analyze. Print, page break 266, 77. The nurse is assessing a client who reports having pain during and after urination. The nurse suspects that this client may have a problem with the 1. Bladder, 2. Kidneys, 3. Ureters, 4. Urethra. 1. View answer. 77. 1. Pain during or after voiding indicates a bladder problem. Kidney and ureter pain would be in the flank area. Problems with the urethra would cause pain at the urinary meatus and are commonly felt at the start of voiding. SEN 999 or 142.204.35.194 or September 25, 2025 3:44:23 UTC. NCLEX-RN questions and answers made incredibly easy. ISBN 978 to 14963 to 2549 5 or 7th edition. LISCO Dr. Susan or LISCO Susan. CN, Health Promotion and Maintenance. CNS. N1, CL, apply. 78. A client is ordered diuretics. When should the nurse schedule this medication? 1. Anytime. 2. Nighttime. 3. Morning. 4. Noon. 1. View answer. 78. 3. A diuretic given in the morning has time to work throughout the day. Diuretics given at nighttime will cause the client to get up to go to the bathroom frequently, interrupting sleep. CN, physiological integrity. CNS, pharmacological and parenteral therapies. CL, apply. 79. Which nursing intervention would be the most appropriate for a client with postoperative urinary retention? 1. Give a diuretic. 2. Pour warm water over the perineum. 3. Consider inserting a bladder catheter. 4. Lay the client flat in bed. 1. View answer. 79. 2. Urinary retention reflects bladder distension from urine. Sitting the client upright and pouring warm water over the perineum may help the client void. A diuretic is not necessary. If these measures aren't successful, the nurse should consider getting an order from the provider to insert a bladder catheter. CN, physiological integrity. CNS, basic care and comfort. CL, apply. 80. A client has not voided for 10 hours following an inguinal hernia repair. What would the nurse consider as the cause of this problem? SEN 999 or 142.204.35.194 or September 25, 2025 3:44:23 UTC. NCLEX-RN questions and answers made incredibly easy. ISBN 978 to 14963 to 2549 5 or 7 540. 1. Dehydration. 2. History of smoking. 3. Duration of surgery. 4. Preoperative atropine. 1. View answer. 80. 4. Anticholinergic medications, such as atropine, may cause urinary retention, particularly for the client who has surgery in the pelvic area. Dehydration, smoking, and duration of surgery are not risk factors for urinary retention. Opiate analgesics do pose some risk. CN, physiological integrity. CNS, reduction of risk potential. CL, apply. 81. What is most important for the nurse to teach a client with urinary retentions about self-catheterization? 1. You must keep the catheter clean as it is inserted. 2. Catheterization is not something clients can perform alone. 3. You will need to keep a catheter in at all times. 4. The catheter is used to put fluid into the bladder. 1. View answer. 81. 1. The catheter must be kept clean as it is inserted. In an inpatient setting, nurses generally perform sterile catheterization. In the home setting, the client utilizes clean technique. Clients can be taught to perform clean intermittent self-catheterization. The client does not have to keep the catheter in at all times. The catheter will not be used for irrigation as this is not an intervention for urine retention. CN, physiological integrity, CNS, basic care and comfort, CL, apply. CEN 999 or 142.204.35.194 or September 25, 2025 3:44:23 UTC. NCLEX-RN questions and answers made incredibly easy. ISBN 978 to 14963 to 2549-5 or 7th edition, Lisco Dr. Susan or Lisco Susan. 82. An 80-year-old male client reports urinary retention. Which factor may contribute to this client's problem? 1. Benign prostatic hyperplasia, BPH. 2. Diabetes. 3. Diet. 4. Hypertension. 1. View answer. 82. 1. BPH is common among older adult men and typically results in urinary retention, frequency, dribbling, and difficulty starting the urine stream. Diabetes, diet, and hypertension usually do not affect urinary retention. CN, physiological integrity. CNS, reduction of risk potential, CL, apply. Page break 267. 83. A 75-year-old client is admitted with dehydration. The client's laboratory results are serum sodium 145 meters EQL, serum potassium 5 meters EQL, and serum creatinine 1.2 milligrams DL and a BUN of 28 milligrams DL. Based on these results, the nurse determines that the client is at risk for developing 1. Cancer. 2. Urinary retention. 3. Acute renal failure. 4. Cardiac arrhythmias. 1. View answer. 83. 3. The laboratory results indicate an elevated serum blood urea nitrogen. Normal ranges are from 10 to 20 milligrams DL, which is reflective of dehydration. Volume depletion or dehydration is a risk factor for developing acute renal failure due to decreased perfusion of the kidneys. The serum potassium, sodium, and creatinine levels are within normal range. A normal creatinine level and elevated BUN suggest intravascular fluid volume deficit. CEN 999 or 142.204.35.194 or September 25, 2025 3:44:23 UTC. NCLEX-RN questions and answers made incredibly easy. ISBN 978 to 14963 to 2549-5 or 7th edition, Lisco Dr. Susan or Lisco Susan. CN, physiological integrity. CNS, reduction of risk potential, CL, apply. 84. A client with an overactive neurogenic bladder reports a dry mouth caused by oxybutynin. The nurse is aware that this adverse effect is commonly found with 1. Anti-infectives. 2. Corticosteroid. 3. Urinary antiseptics. 4. Spasmolytics. 1. View answer. 84. 4. Oxybutynin belongs to the spasmolytic drug classification. A common side effect is dry mouth. The other drug classifications do not commonly have an adverse effect of dry mouth. CN, physiological integrity. CNS, pharmacological and parenteral therapies, CL, apply. 85. A client is injected with radiographic contrast medium and immediately shows signs of dyspnea, flushing, and pruritus. What is the nurse's priority intervention? 1. Check vital signs. 2. Make sure the airway is patent. 3. Apply a cold pack to the foresite. 4. call the healthcare provider? 1. View answer, 85. 2. The client is showing symptoms of an allergy to the iodine in the contrast medium. The priority action is to make sure the client's airway is patent. Checking vital signs and calling for the healthcare provider are important nursing actions, but are not the priority. A cold pack is not indicated. CN, physiological integrity, CNS, physiological adaptation, CL, analyze. SEN 999 or 142.200 and 4.35.194 or September 25, 2025, 3:44:23 UTC. NCLEX-RN questions and answers made incredibly easy. ISBN 978-14963 to 2549 547 86. A client is admitted for a cystoscopy with biopsy of the bladder. After obtaining the client's history, surgery was postponed. What would cause this surgery to be postponed? 1. The client stopped taking his anticoagulant 3 days ago. 2. The client has a urinary tract infection. 3. The client was previously been treated for carcinoma of the bladder. 4. The client took an antibiotic prior to the procedure. 1. View answer, 86. 2. Bladder biopsy should not be done when an active urinary tract infection is present because sepsis may result. Anticoagulants should be discontinued for 3 to 5 days before the procedure. The client who has been treated for bladder cancer may still require a biopsy to check effectiveness of treatment. Antibiotics are sometimes given prophylactically prior to the procedure. CN, physiological integrity, CNS, reduction of risk potential, CL, analyze. 87. A client who underwent a cystoscopy is scheduled to be discharged to home within 24 hours. What is the most important information for the nurse to give the client? 1. Expect bloody urine for about a week. 2. Drink 8 to 10 glasses of water every 8 hours. 3. Try to urinate frequently and measure your output. 4. Check the color, consistency, and amount of urine in the indwelling urinary catheter bag every 4 to 8 hours. 1. View answer, 87. 3. The bladder needs to be emptied frequently, and output should be measured to make sure the bladder is emptying. Blood in the urine is not normal except for small amounts for the first 24 hours following the procedure. Large amounts of fluids help flush microorganisms out of the body, but 8 to 10 glasses every 8 hours may not be reasonable. This client may not have an indwelling urinary catheter. CN, physiological integrity, CNS, reduction of risk potential, CL, apply. Print page break 268-88. Before a renal biopsy, which information is most important to tell the healthcare provider? 1. The client signed a consent form. 2. The client understands the procedure. 3. The client has normal urinary elimination. 4. The client regularly takes aspirin or nonsteroidal anti-inflammatory drugs, NSAIDs. 1. View answer, 88. 4. Aspirin and NSAIDs can increase bleeding times and commonly result in hemorrhaging when biopsies are performed. It is the healthcare provider's responsibility to make sure the client understands the procedure, which is needed for informed consent. It is not necessary to report that this client has normal urinary elimination. CN, physiological integrity, CNS, reduction of risk potential, CL, apply. SEN 999 or 142.200 and 4.35.194. Or September 25, 2025, 3:44:23 UTC. NCLEX-RN questions and answers made incredibly easy. 978 to 4963 to 2549. 517th edition. LISCO Dr. Susan or LISCO Susan. It is important to share vital client information. Which instruction would help the client perform Kegel? 1. Completely empty the bladder. 2. Do the exercise 200 times per day. 3. Sit or stand with your legs together. 4. Drink small amounts of fluid frequently. View answer 89. 2. Exercises begin with tightening and relaxing the vagina, rectum, and urethra 2 or 3 times a day. Depending on the strength of the pelvic musculature, anywhere from 10 to 30 repetitions can be done petitions during each session and gradually increased. The client stops the flow of urine during urination to practice holding the flow. Standing or sitting with the legs apart will facilitate the exercises. Clients should drink 2 to 3 L of fluids to prevent urinary problems. CN, physiological integrity, CNS, physiological adaptation, CL, apply. SEN 999 or 142.204.35, 194.25, September 2000, and 25.344.23 UTC. NCLEX-RN questions and answers made incredibly easy. ISBN 978 to 14963 to 2549 minus 547 1. Stay on bed rest for up to 2 weeks. 2. Use analgesia on a regular basis for up to 6 months. 3. Have a urine culture every 2 weeks for up to 6 months. 4. Antibiotic treatment may be needed for several weeks or months. 1. View answer 90. 4. Chronic pyelonephritis can be a long-term condition requiring antibiotic treatment for several weeks or months, as well as close monitoring to prevent permanent damage to the kidneys. Bed rest and analgesia may be used during the acute stage but usually are not required long-term. A urine culture is done 2 weeks after stopping antibiotics to make sure the infection has been eradicated. CN, physiological integrity, CNS, reduction of risk control, CL, apply. 91. Which client does the nurse determine as being at greatest risk for developing acute renal failure? 1. A dialysis client who gets influenza. 2. A teenager who has an appendectomy. 3. A pregnant woman who has a fractured femur. 4. A client with diabetes who has a heart catheterization. 1. View answer 91. 4. Clients with diabetes are prone to renal insufficiency and renal failure. The contrast used for heart catheterization must be eliminated by the kidneys, causing stress, and may produce acute renal failure. A dialysis client already has end-stage renal disease and would not develop acute renal failure. A teenager who has an appendectomy and a pregnant woman who fractures a femur are not at increased risk for renal failure. CN, health promotion and maintenance. CNS, none. CL, analyze. 92. The nurse is caring for a client who is receiving hemodialysis treatments. Which intervention would be the most appropriate for this client? 1. Palpate for a thrill on the arm with the fistula. 2. Palpate for a thrill on the arm without the fistula. 3. Document the absence of a bruit as a normal finding. 4. Take the blood pressure on the arm with the fistula. 1. View answer 92. 1. The nurse would palpate for a thrill and auscultate for a bruit on the arm with the fistula. No procedures should be done on the arm with the fistula because it could damage the fistula. The absence of a thrill or bruit should be reported promptly to the healthcare provider because it indicates an occlusion and is not a normal finding. CN, physiological integrity. CNS, reduction of risk potential. CL, apply. Print page break 269, 93. A client has passed renal calculi. The nurse sends the specimen to the laboratory so it can be analyzed for 1. Antibodies, SEN 999 or 142.200 and 4.35.194 or September 25, 2025, 4423 UTC. NCLEX-RN questions and answers made incredibly easy. ISBN 978 to 1, 4,963 to 2,549 minus. 5 or 7th edition Lisco, Dr. Susan or Lisco Susan. 2. Type of infection. 3. Composition of calculus. 4. Size and number of calculi. 1. View answer. 93. 3. The calculus should be analyzed for composition to determine appropriate interventions such as dietary restrictions. Calculi do not result from infections. The size and number of calculi are not relevant. Calculi do not contain antibodies. CN, physiological integrity. CNS, reduction of risk potential. CL, apply. 94%. Which symptom may indicate acute rejection of a transplanted kidney? 1. Increased urine output. 2. Hypotension. 3. Pain at the graft site. 4. Decreased white blood cell WBC count. 1. View answer. 94. 3. Signs and symptoms of acute rejection of a transplanted kidney include pain at the graft site, decreased urine output, hypertension, elevated WBC count, fever, and elevated creatinine level. CN, physiological integrity. CNS, physiological adaptation. CL, analyze. 95. A client has been placed on prednisone therapy. The client asks the nurse if any adverse reactions can occur when taking the medication. What is the nurse's most appropriate response? 1. Decreased appetite. 2. Sodium loss and constipation. 3. Hypotension. SEN 999, or 142.204.35, 194, or September 25, 2025, 344, 23 UTC. NCLEX-RN questions and answers made incredibly easy. 978 to 1, 4,963 to 2,549 minus. 5 or 7th edition Lisco, Dr. Susan or Lisco Susan. 4. Increased blood glucose levels and decreased wound healing. 1. View answer. 95. 4. Steroid use tends to increase blood glucose levels, particularly in clients with diabetes and borderline diabetes. Steroids cause retention of sodium, increased appetite, and hypertension. Steroids don't affect bleeding tendencies, constipation, or thermoregulation. CN, physiological integrity. CNS, pharmacological and parenteral therapies. CL, analyze. 96. Steroids, such as prednisone and methylprednisolone, are used to suppress the inflammatory immune response following a kidney transplant. Which information should the nurse provide to a client with a transplant? 1. Alopecia may occur. 2. Weight loss is common. 3. Cholesterol levels may become elevated. 4. Hypokalemia may result. 1. View answer. 96. 4. Steroids may decrease serum potassium levels but do not increase cholesterol levels. Hirsutism may occur but not alopecia. Weight gain is commonly reported, not weight loss. CN, physiological integrity. CNS, pharmacological and parenteral therapies. CL, analyze. 97. A nurse suspects that a client with polyuria is experiencing water diuresis. The nurse assesses the laboratory values for which finding. 1. High urine-specific gravity. 2. High urine osmolarity. 3. Normal to low urine-specific gravity. 4. Elevated urine pH. SEN 999 or 142.204.35.194 or September 25, 2025 344 23 UTC. NCLEX-RN questions and answers made incredibly easy. 978 to 1, 4,963 to 2,549 minus. 5 or 7th edition Lisco, Dr. Susan or Lisco Susan. 1. View answer. 97. 3. Water diuresis causes low urine-specific gravity, low urine osmolarity, and a normal to elevated serum sodium level. High urine-specific gravity indicates dehydration. Elevated urine pH can result from potassium deficiency, a high-protein diet, or uncontrolled diabetes. CN, physiological integrity, CNS, physiological adaptation, CL, apply. Print page break 270. 98. A client with bladder cancer has had his bladder removed and an allele conduit created for urine diversion. While changing this client's pouch, the nurse observes that the area around the stoma is red, weeping, and painful. What is the nurse's conclusion? 1. The skin wasn't lubricated before the pouch was applied. 2. The pouch faceplate doesn't fit the stoma. 3. A skin barrier was applied properly. 4. Stoma dilation wasn't performed. 1. View answer. 98. 2. If the pouch faceplate doesn't fit properly, the skin around the stoma will be exposed to continuous urine flow from the stoma, causing excoriation, redness, weeping, and painful skin. A lubricant should not be used because it would prevent the pouch from adhering to the skin. When properly applied, a skin barrier prevents skin excoriation. Stoma dilation is not performed with an ileal conduit. CN, physiological integrity, CNS, basic care and comfort, CL, analyze, 99%. A client is diagnosed with prostate cancer. Which test should the nurse anticipate to monitor this client's progress? 1. Serum creatinine. 2. Complete blood count, CBC. 3. Prostate-specific antigen, PSA. 4. Serum potassium. 1. View answer. 99. The PSA test is used to monitor prostate cancer progression. Higher PSA levels indicate a greater tumor burden. Serum creatinine levels may suggest blockage from an enlarged prostate. CBC is used to diagnose anemia and polycythemia. Serum potassium levels identify hypokalemia and hyperkalemia. CN, physiological integrity. CNS, physiological adaptation. CL, apply. 100%. When teaching a client about cystitis, a nurse explains that females are more prone to the disorder than males. Which factor explains a female's increased susceptibility? 1. Higher estrogen levels. 2. Inadequate fluid intake. 3. Urethral proximity to the rectum. 4. Continuous nature of the mucosa, SIN 999, or 142.204.35.194, or September 25, 2025 3:44:23 UTC. NCLEX-RN questions and answers made incredibly easy. ISBN 978-1 4963-2549-. 5 or 7th edition LISCO, Dr. Susan or LISCO Susan. 1. View answer. 100. In females, the urectums create a risk for urethral contamination with feces after a bowel movement. Decreased estrogen levels may reduce vaginal and urethral lubrication, increasing the chance of irritation during coitus. Males and females can have equivalent fluid intake. The mucosa is continuous in both males and females. CN, physiological integrity, CNS, physiological adaptation, CL, apply. 101. A client presents with a possible urinary tract infection. Which urine characteristic should the nurse assess first? 1. Urine clarity. 2. Urine-specific gravity. 3. Urine acetone. 4. Urine protein. 1. View answer. 101. 1. The nurse should first assess urine clarity. Cloudy urine usually indicates drainage, which may indicate an infection. Urine-specific gravity provides information about fluid balance. Neither urine acetone nor urine protein indicates infection. CN, health promotion and maintenance, CNS, N1, CL, analyze. 102. A 70-year-old male client is diagnosed with syphilis in the secondary stage. Which finding should the nurse expect during assessment? 1. Chronic bone and joint irritation. 2. Tender lymphadenopathy. 3. generalized rash on the palms and soles, SEN 999, or 142.204.35.194, or September 25, 2025, 3:44:23 UTC. NCLEX-RN questions and answers made incredibly easy. 978 to 1, 4,963 to 2,549 minus. 5 or 7th edition LISCO, Dr. Susan or LISCO Susan. 4. Personality changes and mental confusion. 1. View answer, 102. 3. In secondary syphilis, a maculopapular, non-pruritic rash appears on the palms and soles. Chronic bone and joint irritation are not related to secondary syphilis. During the second stage of syphilis, non-tender lymphadenopathy occurs. Personality changes occur during the late stage of syphilis. CN, physiological integrity, CNS, basic care and comfort, CL, apply. Print page break 271. 103. A client has received ceftriaxone for the treatment of gonorrhea. What is the most important information for the nurse to teach this client? 1. Take this medication with food or milk. 2. Report pain, tenderness, or warmth at the injection site. 3. Take the medication every other day. 4. Call your healthcare provider if you have diarrhea and cramping. 1. View answer. 103. 4. Diarrhea and cramping can cause the client to have fluid and electrolyte disturbances and should be reported to the provider immediately. The nurse should also teach the client that pain and tenderness can develop at the injection site. Though not a priority, this should be monitored. The medication is not taken orally and is taken daily. CN, physiological integrity, CNS, pharmacological and parenteral therapies, CL, apply. SEN 999, or 142.204.35.194, or September 25, 2025, 3:44:23 UTC. NCLEX-RN questions and answers made incredibly easy. ISBN 978 to 1 4,963 to 2,549 minus. 5 or 7th edition LISCO Dr. Susan or LISCO Susan. Assessment finding would indicate that a client with renal failure is experiencing hypocalcemia. 1. Headache. 2. Increased urinary output. 3. Increased blood coagulation. 4. Diarrhea. 1. View answer, 104. 4. In renal failure, calcium absorption from the intestine declines, leading to increased smooth muscle contractions, causing diarrhea. Central nervous system changes in renal failure rarely cause headache. As renal failure progresses, bleeding tendencies increase. CN, health promotion and maintenance, CNS, and none, CL, apply. 105. A client who became paraplegic after a swimming accident is experiencing autonomic dysreflexia. Which condition is the most common cause of autonomic dysreflexia? 1. Upper respiratory infection. 2. Incontinence. 3. Bladder distension. 4. Diarrhea. 1. View answer, 105. 3. Autonomic dysreflexia is a potentially life-threatening complication of spinal cord injury occurring from obstruction of the urinary system or bowel. An upper respiratory infection could obstruct the respiratory system but not the urinary or bowel system. Incontinence and diarrhea do not result in obstruction of the urinary system or bowel. CN, physiological integrity, CNS, physiological adaptation, CL, analyze. SEN 999 or 142.204.35.194, or September 25, 2025, 3:44:23 UTC. NCLEX-RN questions and answers made incredibly easy. ISBN 978 to 1 4,963 to 2,549 minus. 5 or 7th edition Lisco, Dr. Susan, or Lisco Susan. Avoid physical activity. 2. Strain all urine. 3. Seek early treatment for respiratory infection. 4. Monitor urine-specific gravity every day. 1. View answer. 106. 3. Hemolytic streptococci are common in throat infections and can cause an immune reaction that results in glomerular damage. This client should seek early treatment for a respiratory infection. Avoiding physical activity may promote urination, but does not prevent recurrence of glomerulonephritis. Straining the urine helps identify renal calculi that have passed through the urine. Daily monitoring of urine-specific gravity will help assess hydration status but does not aid in glomerulonephritis prevention. CN, physiological integrity. CNS, reduction of risk potential. CL, analyze. 107. After radical prostatectomy for prostate cancer, a client has an indwelling catheter removed. He then begins to have periods of incontinence. During the postoperative period, which intervention should be implemented first? 1. Kegel exercises. 2. Fluid restriction. 3. Artificial sphincter use. 4. Self-catheterization. 1. View answer. 107. 1. Kegel exercises are non-invasive and are recommended as the initial intervention for incontinence. Fluid restriction is useful for a client with increased detrusor contraction related to acidic urine. Artificial sphincter use is not a primary intervention for post-prostatectomy incontinence. Self-catheterization may be used as a temporary measure but is not a primary intervention. CN, physiological integrity. CNS, physiological adaptation. CL, apply. CEN 999 or 142.204.35.194 or September 25, 2025 3:44:23 UTC. NCLEX-RN questions and answers made incredibly easy. ISBN 978 to 14963 to 2549-. 5 or 7th edition Lisco Dr. Susan or Lisco Susan. Print page break 272. 108. When providing discharge teaching for a client with uric acid calculi, the nurse should include an instruction to avoid. 1. Cottage cheese. 2. Beets. 3. Spinach. 4. Organ meats. 1. View answer. 108. 4. To control uric acid calculi, the client should avoid high purine foods such as organ meats. Beets and spinach are high in oxalate. Cottage cheese is high in calcium. CN, physiological integrity. CNS, reduction of risk potential. CL, apply. 109. A client with nephrotic syndrome has developed anasarca, which abnormally low laboratory value would indicate this assessment finding. 1. Cholesterol. 2. Prothrombin time. 3. Albumin. 4. Calcium. 1. View answer. 109. 3. When the glomeruli are damaged, the kidneys are excessively permeable to plasma protein, causing proteinuria and hypoalbuminemia. This leads to a decreased oncotic pressure, which results in anasarca. CN, physiological integrity. CNS, physiological adaptation. CL, apply. After a retropubic prostatectomy, a client requires continuous bladder irrigation. The client has an IV of dextrose 5% in water, infusing at 40 milliliters HR, and a triple lumen urinary catheter with normal saline solution, infusing at 200 milliliters HR. The nurse empties the urinary catheter drainage bag 3 times during an 8-hour period for a total of 2,780 milliliters. How many milliliters does the nurse calculate as urine? Record your answer using a whole number. DET-ml, CEN 999, or 142.200 and 435.194, or September 25, 2025 3:44:23 UTC. NCLEX-RN questions and answers made incredibly easy. 978 to 1 4,963 to 2,549 minus. 5 or 7th edition, Lisco Dr. Susan or Lisco Susan. 1. View answer. 110. 1,180. During 8 hours, 1,600 milliliter of bladder irrigation has been infused. 200 milliliters x 8 hours equal to 1,600 milliliter. The nurse then subtracts this amount of infused bladder irrigation from the total volume in the drainage bag to determine urine output. 2,780 milliliters. 1,600 milliliter equal to 1,180 milliliter. CN, Physiological Integrity, CNS, Basic Care and Comfort, CL, Analyze. 111. A nurse is caring for a client with chronic renal failure. The laboratory results indicate hypocalcemia and hyperphosphatemia. Which signs and symptoms should the nurse expect to find in this client? Select all that apply. 1. Trousseau's sign. 2. Cardiac arrhythmias. 3. Constipation. 4. Decreased clotting time. 5. Drowsiness and lethargy. 6. Fractures. 1. View answer. 111. 1, 2, 6. Hypocalcemia is a calcium deficit that causes nerve fiber irritability and repetitive muscle spasms. Signs and symptoms of hypocalcemia include Trousseau's sign, cardiac arrhythmias, diarrhea, increased clotting, anxiety, and irritability. CN, Physiological Integrity, CNS, Reduction of Risk Potential, CL, apply. 112. A client with chronic renal failure plans to receive a transplanted kidney. The healthcare provider recently told the client that he is a poor candidate for transplant because of chronic uncontrolled hypertension and type 1 diabetes mellitus. The client tells the nurse, "I want to go off dialysis. I'd rather not live than be on this treatment for the rest of my life." How should the nurse respond to this client? Select all that apply. 1. Say nothing. Sit quietly next to the client. 2. Tell the client we all have days when we don't feel like going on. 3. Leave the room to allow the client to collect his thoughts. 4. Say to the client, "You're feeling upset about the news you got about the transplant." 5. Tell the client your treatments are only 3 days a week. You can live with that. 1. View answer. 112. 1-4. Silence is a therapeutic communication technique that allows the nurse and client to reflect on what has taken place or what has been said. By waiting quietly and attentively, the nurse encourages the client to initiate and maintain conversation. By reflecting the client's implied feelings, the nurse also promotes communication. Using platitudes such as, "We all have days when we don't feel like going on," the nurse fails to address this client's needs. The nurse should not leave the client alone because he may harm himself. Reminding the client of the treatment frequency does not address his feelings. CN, Psychosocial Integrity, CNS, none. CL, Analyze. 113. The radiology nurse is reviewing a list of home medications of a client scheduled for an outpatient intravenous pyelogram IVP at 10 a.m. The client took the following medications at home with sips of water at 8 a.m., which medication would prompt the nurse to contact the healthcare provider. SEN 999 or 142.204.35.194 or September 25, 2025 3:44:23 UTC. NCLEX-RN questions and answers made incredibly easy. ISBN 978 to 1,4963 to 2,549 minus. 5 or 7th edition, Lisco Dr. Susan or Lisco Susan. 1. Metoprolol, 25 milligrams by mouth. 2. Sitagliptin, 100 milligrams by mouth. 3. Metformin, 500 milligrams by mouth. 4. Lorazepam, 0.5 milligrams by mouth. 1. View answer. 113. 3. Metformin, a biguanide oral hypoglycemic agent, should be held 24 hours before and 48 hours after IVP to reduce the potential of lactic acidosis and renal failure. Sitagliptin, metoprolol, and lorazepam do not produce harmful effects when IV contrast is administered. CN, physiological integrity, CNS, pharmacological and parenteral therapies, CL, apply. 114. The nurse is caring for a client with acute glomerulonephritis. Which signs and symptoms would the nurse anticipate? Select all that apply. 1. Fatigue. 2. Periorbital edema. 3. Thromboemboli. 4. Cola-colored urine. 5. Hypertension. 6. Proteinuria. 1. View answer. 114. 1, 2, 4, 5, 6. Fatigue, periorbital edema, hematuria, cola-colored urine, hypertension, and proteinuria are common manifestations of acute glomerulonephritis. Thromboemboli are common manifestations of nephrotic syndrome. 115. The nurse is reviewing admission orders for a client with a diagnosis of pneumonia. The client has no known drug allergies. The client's laboratory results consist of blood urea nitrogen BUN 29 mg DL and creatinine 2.8 mg DL, which of SEN 999 or 142.200 and 4.35, 194, or September 25, 2025 3:44:23 UTC. NCLEX-RN questions and answers made incredibly easy. ISBN 978 to 14963 to 2549-5 or 7th edition, Lisco Dr. Susan or Lisco Susan. The healthcare provider's orders. Would the nurse question? 1. Gentamicin 150 mg intravenous piggyback IVPBQ 24H. 2. Doxycycline 100 mg IVPBQ 12H3. Rosefin 1 gram IVPBQ 24H4. Zithromax 500 mg IVPBQ 24H1. View answer 115. 1. The aminoglycoside gentamicin may be nephrotoxic when administered to a client with altered renal function. This client's BUN and creatinine are elevated. The client is elderly, placing them at increased risk for the nephrotoxic effects of medications. CN, physiological integrity, CNS, pharmacological and parenteral therapies, CL, analyze. 116. The spouse of a client diagnosed with acute glomerulonephritis asks the nurse to clarify foods that are a complete source of protein. Which food should the nurse include in this list? Select all that apply. 1. Nuts. 2. Eggs. 3. Fish. 4. Legumes. 5. Soy. 1. View answer. 116. 2, 3, 5. Eggs, fish, soy, meat, poultry, and dairy all contain essential amino acids and are considered a source of complete protein. When renal function is impaired, urea accumulates in the body as a result of impaired protein metabolism. Complete proteins are efficiently metabolized by the body, reducing urea accumulation. CN, physiological integrity, CNS, basic care and comfort, CL, apply. 117. A client diagnosed with acute renal failure voided 260 milliliters of urine on Tuesday. What is the maximum amount of fluid? SEN 999 or 142.200 and 4.35.194, or September 25, 2025 3:44:23 UTC. NCLEX-RN questions and answers made incredibly easy. ISBN 978 to 14963 to 2549-5 or 7th edition, Lisco Dr. Susan or Lisco Susan. The client may consume PO on Wednesday, 1 360 milliliters, 2 500 milliliters, 3 740 milliliters, 4 760 milliliters, 1. View answer 117. 4. The nurse adds the client's urine output for the previous 24 hours 260 milliliters to 500 milliliters, which is the standard amount for insensible losses. 260 milliliters plus 500 milliliters equal to 760 milliliters. CN, physiological integrity, CNS, basic care and comfort, CL, apply. 118. The intensive care unit nurse is explaining the procedure for continuous renal replacement therapy, CRRT, to a client with acute renal failure. Which statement best describes how CRRT will be initiated? 1. I will attach the machine to the central venous catheter the healthcare provider placed in your upper chest. 2. I will attach the machine to the catheter the healthcare provider placed in your abdomen. 3. I will attach the machine to the fistula the healthcare provider placed in your arm. 4. I will attach the machine to the shunt the healthcare provider placed in your arm. 1. View answer 118. 1. Through CRRT, blood from a double-lumen central venous line is slowly filtered and returned to the client. The slow filtration promotes hemodynamic stability and minimizes complications related to changes in extracellular fluid composition. The peritoneal catheter is used for peritoneal dialysis. The fistula and shunt are used for hemodialysis. CN, physiological integrity, CNS, physiological adaptation, CL, apply. 119. The nurse is reviewing the urinalysis results on 4 different adult clients. Which client would the nurse anticipate receiving an IV fluid bolus? 1. A client with a specific gravity of 1.005. 2. A client with a specific gravity of 1.02. 3. A client with a specific gravity of 1.030. 4. A client with a specific gravity of 1.045. 1. View answer 119. 4. Specific gravity measures the ratio of the density of urine compared to the density of an equal volume of water and is a reflection of the client's hydration status. Normal specific gravity in adults ranges between 1.016 and 1.030. An elevated specific gravity indicates that the client is dehydrated. CN, physiological integrity. CNS, reduction of risk potential. CL, analyze. 120. A male client tells the nurse he has been taking saw palmetto by mouth twice a day for the past 3 years as treatment for urinary hesitancy due to an enlarged prostate. What is the priority nursing assessment for this client? 1. Hypertension, SEN 999, or 142.200 and 4.35.194, or September 25, 2025 3. 4423 UTC. NCLEX-RN questions and answers made incredibly easy. 978 to 4963 to 2549 minus. 5 or 7th edition, Lisco Dr. Susan or Lisco Susan. 2. Jaundice. 3. Joint pain. 4. Dry mouth. 1. View answer 120. 2. Saw palmetto is used by more than 2 million men to treat benign prostatic hypertrophy and may cause damage to the liver and pancreas. The nurse should assess for signs of jaundice as an adverse effect of using saw palmetto. CN, physiological integrity, CNS, pharmacological and parenteral therapies, CL, apply. Print page break 275, 121. A female client is at the clinic for her yearly gynecological evaluation. She expresses concern about a family friend who recently had a hysterectomy due to cancer and asks the nurse how she can prevent this type of cancer. Which statements describe how to prevent this type of cancer? Select all that apply. 1. Not smoking reduces risk for cervical cancer. 2. A high-fat diet decreases risk for ovarian cancer. 3. Using condoms reduces risk for cervical cancer. 4. Limiting your number of sexual partners reduces risk for cervical cancer. 5. A human papillomavirus quadrivalent type 6, 11, 16, and 18 vaccine, given as an injection 2 times over a 6-month period, can reduce risk for cervical cancer. 1. View answer. 121. 1, 3, 4. Not smoking, using condoms, and limiting the number of sexual partners can reduce the risk for cervical cancer. A high-fat diet increases the risk for ovarian cancer. A human papillomavirus quadrivalent, type 6, 11, 16, and 18, vaccine is given as 3 intramuscular injections over a 6-month period. SED 999, or 142.200 and 4.35.194, or September 25, 2025, 3:44:23 UTC. NCLEX-RN questions and answers made incredibly easy. ISBN 978-14963-2549-5 or 7th edition, LISCO Dr. Susan or LISCO Susan. CN, physiological integrity. CNS, reduction of risk potential. CL, apply. 122. The nurse is to prepare a client diagnosed with acute kidney injury (AKI) for a renal radiologic study. The healthcare provider orders the client to have the bowel evacuated before the study. Which orders for bowel evacuation would the nurse question? Select all that apply. 1. Soap suds cleansing enema until clear. 2. Fleet enema until clear. 3. Bisacodyl 15 mg PO. 4. Magnesium citrate 240 milliliters PO. 5. Castor oil 30 milliliters PO. 1. View answer. 122. 2. 4. Fleet enema and magnesium citrate are hyperosmolar solutions, which are contraindicated for those with renal problems. The salt content in these solutions can cause toxicity. Soap suds, enema, bisacodyl, and castor oil may be used. CN. Physiological integrity, CNS. Pharmacological and parental therapies, CL, apply. 123. A client who is alert and oriented has been receiving hemodialysis 3 times per week for the last 5 years. The client's condition has gradually declined, and the client tells the dialysis nurse, "I don't want to do this anymore. I'm tired and ready to let my body shut down. I know that I'll die, but I'm ready." What is the most appropriate response by the nurse? 1. I understand. My grandmother decided to give up too. 2. You are just having a really bad day. You will feel better tomorrow. SEN 999, or 142.200 and 4.35.194. Or September 25, 2025, 3:44:23 UTC. NCLEX-RN questions and answers made incredibly easy. ISBN 9781 4963 2549 517th edition. LISCO, Dr. Susan or LISCO Susan. 3. Have you thought about how your children will react? 4. Are you saying you no longer want to receive dialysis treatments? View answer. 123. 4. Clarification is a therapeutic communication technique that is helpful in validating the intended meaning of the client's statement. Insinuating that the client decided to give up is judgmental. Telling the client he is having a bad day invalidates his feelings. Asking how his children will react places guilt on the client. CN. Psychosocial integrity, CNS, none, CL, apply. You were right on target with Chapter 10. Now aim